Hi, this is Dr. Asher. I've been practicing since almost 28 years. I have seen lot of pathological cases. And in all these cases, GHK knowledge, German New Medicine, has been a key factor. How it has been a key factor? It takes off that fear of disease from your mind. It helps us how the body is surviving, how and what the pathological changes in our body which are taking place are for survival. It's not something we should fear of. This has helped me in understanding the patient better, as well as why he is suffering and how I can take him on a journey to complete recovery and cure. Today's case, which I'm going to discuss, is going to be a nephrotic syndrome, a child suffering from nephrotic syndrome, and what has to be your approach in all these nephrotic syndrome cases. The panic which comes in the parent's mind can be easily solved or resolved, or we can make them calmer by making them understand by only the help of German New Medicine or GHK knowledge. So, my dear friends, here I'm going to make it easy for you to understand how to approach kidney problems and nephrotic syndrome cases. Nowadays, you find these nephrotic syndrome cases a lot. So I'm sure if this approach you put in your daily life and your practice, you can solve many of the cases. So let's take this ahead. I will show you a small PPT presentation, which will help you replicate this in your practice and solve most of these cases. So let's go ahead and see how I approached in this case. So once again, welcome to the GHK Global GHK webinar. And the case of nephrotic syndrome and the GNM approach. The disclaimer, the information given in this presentation is for educational purpose only. Now, when I started my practice, we used to give medicines, homeopathic medicines. But with homeopathic medicine, the knowledge of disease was something which was not clear. German New Medicine helped me understand where and how my medicine is going to help reverse the most grave pathologies, which now I am easily able to treat. I am easily able to recover. The so-called most incurable cases are also easily solved. The congenital diseases are also easily solved. If you see my Insta page, we have a lot of cases where the congenital diseases are also showing solution. I'm using a word disease because the world uses the word disease, but basically these diseases are nothing but the survival mechanism. I repeat, the survival mechanism. What is a nephrotic syndrome? Nephrotic syndrome is a kidney disorder that causes your body to pass too much protein in your urine. Nephrotic syndrome is usually caused by damage to the cluster of small blood vessels in your kidney that filter waste and excess water from your blood. Common symptoms include severe swelling. My patient also came with severe swelling, edema, particularly around the eyes and in your ankle and feet, foamy urine, a result of excess protein in your urine, weight gain due to fluid retention, fatigue, loss of appetite. So, what to do when you have a patient like this sitting in front of you? What should come in your mind? What questions are you going to pose this patient? How accurately are you going to investigate? Is what we are going to see in the coming presentation. Case 9 years age, guy, a male, religion Muslim, presenting complaint, a known case of steroid dependent nephrotic syndrome since 1.5 years of age, recurrent upper respiratory tract infections on almost every 8 to 15 days, followed by ascites and anasarca if no antibiotics given. So they had to give him antibiotics and medicines. There used to be proteinuria and hematuria with pain and difficult urinations. Recurrent coryza and pneumonia few days after birth, followed by swelling over eyelids and then anasarca. Was put on steroid, which continued till date. They are not able to withdraw, they are not able to stop the steroids. Itching and macular rash on the skin due to omnacotyl, this common side effects of the steroids. Stunted height and growth due to the steroids. See what these medicines are doing. They are not going with the nature. So naturally, the nature is not going to show a normal growth and recovery. Tapping has to be done for ascites, otherwise he gets breathless. So these were his reports. If you see in the report, the protein present are 4 plus. Urea is high, SGOT, SGPT is also high. What medication he is on? He's on omnacotyl, tacrolimus, lacilactone, which is also a diuretic, Monter LC, which is what they give as an immune booster in allopathy for chest infections, Budocort inhalers and tablets to be given SOS, and Levolin was used SOS. This is what the mother has to say. Please hear what the mother has to say, because every word is very, very important. You will see in the end of the case, what she says is how much important to consider if you want to reverse these pathology. Again, I'm saying every word is important. If you want to reverse these pathology, listen to her.
जी वो क्या तकलीफ होती है उसको?
उसको सूजन आ जाती है सर, हर 15 दिन पर सर्दी होती है उसको। सर्दी होती है, बस सूजन आती है, पेट में पानी जमा होने लगता है।
ओके, कब से शुरू हुआ ये सब उसका?
ये सब तो 7 साल के तब से ही शुरू हो रहा है, 7 साल से हो रहा है।
7 साल से? यानी कितने साल का था वो? 2 साल का?
1-1.5 साल का ही था, तब से ही प्रॉब्लम शुरू हो गई है।
और उसको सूजन पहले भी आती थी?
नहीं,
पहले नहीं आती थी। जी वो क्या तकलीफ होती है उसको?
उसको सूजन आ जाती है सर, हर 15 दिन पर सर्दी होती है उसको। सर्दी होती है, बस सूजन आती है, पेट में पानी जमा होने लगता है।
ओके, कब से शुरू हुआ ये सब उसका?
ये सब तो 7 साल के तब से ही शुरू हो रहा है, 7 साल से हो रहा है।
7 साल से? यानी कितने साल का था वो? 2 साल का?
1-1.5 साल का ही था।
So she's saying since 1.5 years of age she's suffering.
पहले नहीं आती।
If you don't understand the language, it is written down. The translation is given down. Subtitles are coming down. Concentrate on the subtitles.
बॉडी अभी जैसे फूली है ना, उसकी वैसे फूल जाती है, काम हो जाता है ना तो एकदम वीक हो जाता है, कमजोर।
ओके, पानी जमा हो जाता है ना उसकी वजह से।
हाँ, फिर वो लैसिलैक्टोन का टैबलेट दो, तभी उसके पेट का पानी निकलता है।
ओके,
ये फिर नहीं निकल पाता है तो फिर एडमिट करते हैं इसे।
फिर एडमिट करके क्या देते हो लोग?
एल्बुमिन चढ़ाते हैं उसको।
उसके बाद कब होता है? ओके, यूरिन के अंदर एल्बुमिन लॉस होता है और प्रोटीन लॉस होता है। प्रोटीन कितना लॉस रहता है उसका?
3 प्लस आता है, 4 प्लस
रोज? ओके, अच्छा बैठो, अच्छा ऊपर बैठो, ऊपर बैठो, उधर उधर। जैकेट तो बहुत भारी है, किसका जैकेट है? तुम्हारा है? क्या नाम है तुम्हारा? हाँ, जोर से, पूरा नाम? मोहम्मद सुजैर। आगे? अब्बा का नाम क्या है? और सरनेम क्या है तुम्हारा? शेख, खान, पठान, अंसारी, क्या? पूरा नाम बोलो, पूरा नाम। ओके। हाँ, तो फिर इसको ये शुरुआत कब से हुई, यानी सिर्फ सर्दी होती थी और सूजन आने लगी थी? हाँ, उसके बाद फिर उसको दवाई दी तो ठीक हो जाता था वो?
हाँ, दवाई तो ओमनाकॉटिल का डोज बढ़ा दो तो कम हो जाता है।
वो तो अभी ना, ओमनाकॉटिल शुरुआत जब हुई तब, 1 साल का जब था वो, तब
भी ओमनाकॉटिल शुरू था मुझसे।
अच्छा, तब भी देते थे?
तब से ही शुरू है, तो
और
अभी तक
निमोनिया पहले हुआ कि पहले ये बीमारी पहले मालूम गिरी?
निमोनिया, सर्दी होने लगी, निमोनिया हुआ तभी ये हुआ।
निमोनिया भी ये पता चला? अच्छा, ये पता चला था। ओके, फिर क्या ट्रीटमेंट चालू रहती है अभी?
अभी ओमनाकॉटिल, टैक्रोलिमास वगैरह
वो देते रहते हैं? ओके, और प्रोटीन 3+ ही रहता है?
3+। सर्दी कम होती है 2+, 1+ होता है, फिर 8-15 दिन के बाद फिर सर्दी होती है, फिर वापस 3+, 4+ होता है।
ओके, सर्दी के लिए दवाई दिए तो उसको स्वेलिंग आ जाती है, पेट में पानी होता है? क्या नहीं दिए दवाई तो भी आता है?
नहीं दिए तब होता है।
नहीं दिए तब होता है?
हाँ,
सर्दी की दवाई?
सर्दी की दवाई
और एंटीबायोटिक वगैरह दे दिए तो
कम हो जाती है, तो फिर नॉर्मल रहता है।
ओके। और
तो ओमनाकॉटिल की वजह से सब बॉडी पर उसपे खुजलियां आ रही है, ऐसे बारीक बारीक दाना आ रहे, घुटने पर, कोहनी पर।
Is getting itching and boils over the skin due to the steroids. That's what they are saying.
ये सब चीज का उसके नेचर के ऊपर क्या असर होता है?
बॉडी नहीं बढ़ती है सर, उसकी हाइट नहीं बढ़ती है।
His body and height is not growing, and he gets angry and irritated very fast.
जैसे नॉर्मल रहता है, जब तबीयत थोड़ी डाउन है एकदम चिढ़ता है, चिड़चिड़ करने लगता है।
करते हैं गुस्सा।
ओके, और चिड़चिड़ कब और कैसी रहेगी चिड़चिड़ ये?
गुस्सा आता है सर, कुछ खाता पीता नहीं है, बाहर की चीज के लिए जिद करता है।
He gets angry, doesn't eat, and keeps asking for outside
तो
food.
तभी खाता है, घर का खाना नहीं खाता है।
ओके, चिड़चिड़ गुस्सा सबके ऊपर रहेगा क्या, स्पेसिफिकली किसी एक के ऊपर रहेगा?
नहीं, सबके ऊपर।
बाहर वालों के ऊपर?
नहीं, बाहर नहीं, घर के
He
ऊपर
gets
रहता है।
घर में
irritated
चिड़चिड़
only
करेगा,
at
तो
home
बाहर ऐसा
people.
एकदम
This is
सीधा
very important,
शरीफ
not
बच्चा है।
outsiders.
स्कूल के अंदर भी एकदम शरीफ है?
हाँ, स्कूल के अंदर।
ओके, और बताओ उसके बारे में। दोस्ती इजीली करता है कि नहीं करता है?
नहीं, खुद से नहीं करते।
Does he make friends easily? No. Initially, he's shy, and then later on, he becomes friend. Now also, if you see, initially he was standing, sitting on the table behind, and gradually when he knew that the physician is now a good friend, he came and stood very close. This is all what you have to observe. So this was his situation, the eye swelling, the abdomen swollen up. This is how the patient used to be in his suffering situations. Let's understand the disease through GNM perspective. So the organ responsible is kidney collecting tubules. It's controlled from the brain stem, and it originates from the endoderm. The control center, the kidney collecting tubules of the right kidney, originally responsible for the urea cycle conversion of ammonia into urea, are controlled from the right side of the brain stem. The kidney collecting tubules of the left kidney, originally responsible for the processing water, are controlled from the left brain hemisphere. Today, both the kidneys share the same function. Physiology of collecting tubules. Urine production in the renal parenchyma is what happens. Pass through the collecting tubules to the renal pelvis, reabsorbs 99% of the filtrate and returns to the blood stream. The biological conflict, which is most important cause of the problem, which we can also consider when we take ailments from, when we have to repertorize in homeopathy, is here which we get the clue from. The biological conflict linked to the kidney collecting tubules originates at a time when life existed only in the ocean and being thrust out of the water environment, create a life-threatening situation. This kind of distress are also concerns human life because water is the primordial home of all living organisms. We humans experience the conflict as feeling like a fish out of water when we are unexpectedly swept out of a familiar surrounding or when we lose our pack. In GNM, we refer the conflict of the kidney collecting tubules as an abandonment conflict, existent conflict, and refugee conflict. Let me explain here. Fish like a fish out of water. For humans, the fish like out of water is like you are out of the familiar environment. Suddenly you find that the people around you or something where you belonged to, you don't have those people and things around you. When such things happen, you feel abandoned. You feel, how will I exist? And you feel it's like a refugee. I am not in my place. I am not in my country. I am temporary in somebody else's place. This feeling is enough to cause this survival mechanism changes in our body. So abandoned conflict is brought out by feeling ousted, excluded, unwanted, rejected, not understood, ignored, left out, isolated, and alone. How many times our patients or the people who are suffering come and tell this, but we don't even think about it, what it is doing to the body and the kidney. Children especially experience the conflict when they are put into the daycare, when they feel unloved or excluded from the group. Don't you think this is so common nowadays? The parents are working and they keep the child in the daycare from morning to evening. The child, what he's going through, can trigger this conflict in them. And when the child suffers, they never realize this. The parents don't realize this. Neither the physician who start and put them on steroids. So common nowadays, so common this situation. When the children, when they feel unloved and excluded from the group, when their parents don't spend enough time with them, we don't spend enough time with our children, that can also trigger it if the child is so sensitive. When a new sibling is born, the sibling jealousy, a new sibling coming in, and suddenly the love and care is diverted. This all is what happens. When grandparents dies or when a family member leaves, it is loss of safety and loss of emotional shelter, which makes them feel utterly alone. So don't you think nowadays it's so common? Newborns are equally vulnerable by keeping them immediately into the incubators. Thus, being taken away from mother at birth for one or other reason can cause severe abandonment conflicts. The existent conflict is fear of one's life, equal to fish out of water. The fear is often triggered by a cancer diagnosis. You suddenly say you have a cancer and you are no more going to live for a longer time. This is not curable. Or a sudden shock given A diagnosis shock, a cancer diagnosis shock is enough for the person to feel out of the water, because water was the life of that person. Negative prognosis, my life is at stake, death, fright, conflict. Waiting in an emergency room, being in an ambulance or hospitalization can also trigger this. The existent conflict also relates to one's livelihood. You suddenly were doing good, you were earning well, and things changed. So many people suffered this during COVID. Their livelihood was gone. They could not earn. I have lost everything. This could be a loss of workplace, financial losses, loss of home. Those people who have famine, those people who have floods, and then their home is lost, or a fire which breaks out, takes away the home, is what they feel. How will they exist? The wars which are going on now, the everything destroys their home, everything is gone. How will they exist? Is enough to trigger. So don't you think this disease is going to be, rather the survival mechanism is going to be so common nowadays? So we all GHK doctors and practitioners should be ready for this. This is what it is. The refugee conflict is thrown away into desert, all feeling uprooted or in exile due to unexpected transfers. Suddenly you're transferred from your homeland to somewhere else can also provoke this. So there are so many reasons today we learned that if the patient comes in, we need to investigate this thoroughly and then make them aware. Conflict found in my case was in the last trimester, mother was sent to her mom's place by the husband. And he was going through, as the husband was going through financial crisis. He could not provide money to her, not even medicines and even food. Her parents has to pay all her hospital and medicine bills. She never liked this, but could not confront him because of his temper. When I used to look at my friends, means the patient's mother, their husbands were caring and protecting. My husband should also look at my needs. She used to feel that he should also be with me. The husband should be with me in these times, but he had no time for me. He didn't even accompany me during my hospital visits. I always had to be careful while speaking with him because he used to stop talking to me in anger and used to stay out for hours without informing. I used to keep calling and waiting for him in anxiety, but he wouldn't respond. What if he does something wrong in anger? See how the mother is feeling and the child is in the womb. Very, very important. Something which is very important is going to come up. The 9 months of the pregnancy of the mother and her thought process is affecting the child. This is what you're going to learn in this presentation. What if he does something wrong in anger? During that time, he was afraid, as her great mother-in-law, who was strictly against the cesarean delivery. She was always apprehensive that if she needed a cesarean delivery, my mother-in-law would become enraged and might reprimand and blame her. She would constantly chastise her to work during pregnancy in order to have normal delivery. Also, she used to admonish her mother-in-law for not letting for work. This caused mother to be constantly afraid and anxious about upcoming delivery. What would she do if I have to take a cesarean at the last moment? This was the anxiety which was building up in the mother. So we talked to the mother and this is what she said.
प्रेगनेंसी के अंदर क्या टेंशन था? ये पहला बच्चा है क्या? इसके ऊपर बच्चे हैं?
नहीं, पहले
पहला है। क्या टेंशन था प्रेगनेंसी के टाइम पे?
कुछ भी नहीं सर, बस घर का ही था।
हाँ वही बताओ ना, क्या थोड़ा बहुत क्या था? ये भाई, ये आपके हस्बैंड थे क्या?
हस्बैंड।
ओके, इनसे रिलेटेड क्या टेंशन रहता था तो?
नहीं, इनसे कोई टेंशन।
हाँ, फिर?
So this was the conflict during pregnancy. The mother is saying all what I read, that the husband never cared. She wanted love, affection. The husband sent her back to her mother's place. She did not want to go to mother's place. This was her house, she said, but then because there was no money, so there was an existence conflict. So how she felt? The mother was asked to stay at her native place against her will. She couldn't express her emotions out of fear and anxiety. Was neglected by husband in later month of pregnancy due to his financial problem. When she tried to show her displeasure, he used to get out of the house, leaving her anxious. This used to be the husband's reaction. Existent was anxious about her upcoming delivery. Mother-in-law would blame her if she requires cesarean delivery. Fear of surgery and going to the hospital. What happens in the conflict active phase when this is going on? The endoderm, the oldest biological layer, organ controlled by the brain stem, linked to the oldest biological conflict is breathing, procreation, and food. The adaptation is cell proliferation, and additional cells are removed with the help of fungi, tubercular bacteria. This is what happens exactly at the brain stem. The brain stem is the oldest brain. The oldest brain, usually there is cell proliferation, and this cell proliferation, the fungi and the tubercular bacteria come to eat up the dead cells. Cells in the kidney tubules proliferate proportionally to the intensity of the conflict. The intensity of the conflict decides how much proliferation will take place. What is the biological purpose? Why the body does like this? Is the survival mechanism. Again, in GHK, all these things are survival mechanism. So don't fear diseases. They are just survival mechanism. Why the body is behaving like this? If you try to find the conflict and be aware of it, you can reverse the most difficult pathologies. The biological purpose of the cell increase is to close the excretion filter in order to withhold water. So that, very important, so that the organism has a better chance of survival, because water is life. This innate water retention program is vital because without water, all metabolic processes stop functioning. The degree of water retention, here the first line, is determined by the intensity of the conflict. The typical signs of water retention: baggy eyes, swollen hands, ankles, and weight gain, and all that is because of that abundant conflict which has come in. The retention of water and urine results in decreased urine output. In the healing phase, what it has to say, because it is the brainstem and endoderm. If TB bacteria are present, cause bacterial kidney infection, kidney tuberculosis. So you should know all these infections which are coming in are a part of the healing process. It is the body is trying to heal. But doctor make the diagnosis nephrotic syndrome. The tubercle secretion is a rich protein, hence the additional cells are broken down. The elimination of protein through urine is higher than normal. This is clinical termed as proteinuria and albuminuria. How does the conflict resolve? What happens during the conflict resolution? When the conflict is resolved by making patient aware of the cause of his disease, the retained water is immediately released through the unaffected calyces. Depending on the degree of the water retention, the elimination of urine could be profuse. Standard medicine views this copious urination polyuria as abnormal and pathological. With the knowledge of German new medicine and GHK, we welcome this urinary phase with great relief. So the nature of the patient was, we now try to understand. He was completely the child. We knew about the mother, what she has gone through. Now we know the child. We have to treat the child. He was completely different personality as home and outside home. Very angry, obstinate, and egoistic at home. He beats his younger sibling if they don't listen to him. He snatches phone from their hands to watch videos on YouTube. He loves watching Bollywood music videos, never watches cartoon. At school, friends bully him for his short height. He doesn't react or fight, rather reaches out to teachers to complain, only scared of mother as she's strict and punishes him for mistakes. Doesn't mingle with new friends easily, timid in front of the strangers, takes his grandmother to introduce himself to new friends, was sitting quietly with eyes downcast during the history when we were talking to the child and were answering slowly. These were the rubrics. In homeopathy, we collect all the data and we repertorize it. So after understanding the child and the mother's history, we came to these conclusion. The problem with the mother was she was anticipating that she should not go into hospital as cesarean section. So there was a fear always that if she goes for cesarean section, the mother-in-law would not like it. She felt neglected by the husband. Her all emotions were suppressed. The and now these are the rubrics of the child, the behavior problem child in home but good at school with strangers. He had fear, the child had fear of new people. He was answering so slowly, and the main disease or the survival mechanism is here. So we had to give him lycopodium 203 doses, and you see how things improved and reversed. This is after the medicine. The eye swelling is gone. The edema is gone. So this left side was a previous picture and right side is after pictures. He is completely better. These were his reports. The 4+ urine came to 1+. So this is how we spoke to them.
खून निकलता था
हाँ वो कम है अभी
वो कम मतलब आता है अभी भी
नहीं
अभी नहीं आता ना, बंद हो गया ना
बंद।
ओके और दर्द होता था यूरिन करने
हाँ,
को
बंद हो गया है वो
दर्द भी बंद हो
हाँ।
गया ओके ठीक है सूजन आने का पहले से कम है अभी
हाँ जो जैसे बार बार पेट में पानी हो रहा था वैसे नहीं हुआ है अभी
नहीं हुआ ना
नहीं अभी पहले टाइम हुआ है ज्यादा सर्दी होने की वजह से
अच्छा उसकी वजह से बाकी पूरा मंथ वो ठीक था
हाँ
अभी उसका स्वेलिंग कम दिख रहा है पहले से लास्ट टाइम जब आप लाए थे उसको तो थोड़ा सा
अभी तो और भी कम था पर अभी ये 2-3 दिन से
ज्यादा हो गया
हाँ।
ओके ठीक है
हमारे इधर सर्दी बहुत ज्यादा पानी
अच्छा वहां पे ठंडी की वजह से
सुबह 7 बजे की
हाँ ओके ठीक है क्या क्या इम्प्रूव
So he recovered, but he started getting his cold curves back because there was a sting conflict. He used to get irritated very fast. That used to be a sting conflict. So we identified that and gave him medicines.
कैसा था वो पूरे में
Now, GNM of lycopodium. So lycopodium was the medicine given. And how did it work? Why did we select lycopodium? Lycopodium, when does lycopodium fall sick? Lycopodium is ambitious for money power. He may go for any extent to get his dream accomplished. He tries to flatter the dominant person in his boss in order to achieve his goals. So ambition increase, money to make, dictatorial, power of love, flattering. So what? Here we did not have the adult, but here we had a child. The child was cowardice. The child was a dada. He was dominating at home, but outside he was very mild and friendly. The outside people used to bully him. So we selected lycopodium. So if you read from the more details from the radar keynotes, which we refer, is lack of confidence, fear of responsibility, timid people, haughty, egoistic. These are all elders. The children, if you see the last paragraph, are bossy, dictatorial, rude at home. So our child was rude at home, but the timid in school with strangers. Exactly what we saw in our child. So this remedy, when given, completely recovered him, and he is absolutely healthy and fine. So, my dear friends, this was a approach towards nephrotic syndrome. This helped us understand how we should go ahead in understanding and treating nephrotic cases. The mother's history is very important. What the mother has gone through during pregnancy is to be considered. The mother did go through abandoned existence, refugee conflict, right? This is exactly now when a child comes of nephrotic syndrome, you cannot ask him, how does it feel? Did he go from abandon or existence conflict? No. The mother went through a abandoned existence refugee conflict, and that is what the mother felt in the womb. The child also felt the same. What the mother felt, the child felt the same. So if you want to reverse pathologies related to children from birth, if they are suffering, the mother's history is what to be considered is most important. This lecture has this uniqueness in it. The uniqueness is the mother's history and the child's history is what has to be considered, made them aware that this is the reason why the child is suffered, and this is how we can recover difficult pathologies even in children. Thank you so much for the patient listening. Any queries, any more questions which you have, you can contact us on our email listed down, or you can also message us on our Insta, which is Usher Homeopathy. Thank you.